If you have hypothyroidism and are on treatment, here are the top 5 things to do. First, too much thyroid hormone leads to hyperthyroidism, and too little leads to hypothyroidism. So, figuring out the right dosage for you is very important. Factors like age, body weight, and severity of hypothyroidism influence the dosage. So, it is recommended that you get your thyroid levels checked regularly, at least once in 6 months. Second, if you're on thyroid medication, make sure you are taking it on an empty stomach in the morning. Keep a gap of at least 60 minutes before any food intake. Calcium, iron, and high fiber foods or supplements can interfere with the absorption of thyroid medication. So keep a gap of at least 2 hours after taking the medication. Some might take the medication at night, but it might make it difficult for you to fall asleep. Third, foods to avoid. Cruciferous vegetables like broccoli, kale, cabbage, and cauliflower contain compounds called goitrogens, which can interfere with the absorption of iodine. Cooking methods like steaming and boiling can destroy up to 90% of goitrogens, but still keep the intake of these foods very low. It is also important to notice that non celiac gluten sensitivity is seen in most of the hypothyroid patients. So try avoiding gluten containing foods such as wheat, barley, rye, bread, pasta, cakes, and biscuits, and see if that helps. Also, lactose intolerance can lead to poor absorption of nutrients needed for thyroid function. So, if you consume milk and milk products, check for symptoms such as abdominal cramps, diarrhea, and bloating. Fourth is your gut health. Make sure you're consuming 25 to 30 grams of fiber every day. Resistant starches from foods such as chickpeas, green peas, cooked and cooled rice, etc. And probiotics from fermented foods such as idlis, dosas, and kombuchas. Gut enzymes like intestinal sulfatase produced by the microbes convert T4 to T3. So, having a healthy gut, you minimize the fluctuations in thyroid hormone levels. Also, taking a probiotic supplement can be a great addition. Fifth is nutritional deficiencies. Vitamin B12, D3, iron, zinc, and selenium are the most common deficiencies in hypothyroidism. You can benefit from taking a multivitamin that has zinc and 100 to 200 micrograms of selenium. For selenium, you can also take one Brazil nut a day, but the selenium content of Brazil nut varies from 20 to 200 micrograms per nut, making it a very unreliable source of selenium. Vitamin D3 and B12 needs to be supplemented in most cases. For iron, you need to check serum iron levels. In case of deficiency, consider consuming iron-rich foods like amaranth seeds, bajra, ragi, chickpeas, horse gram, and moth beans. And also, you can consider taking supplementation on a doctor's advice. Also, maintaining a healthy weight and regular exercise have a positive impact on overall thyroid health. Thank you for watching Nutritional Perspective. If you like this video, please like, share, and subscribe.